Got it.
Uh,
Morning, guys. How are you doing?
oh,
We're
bless
good.
you. Okay, the floor is yours now.
Thank you very much. Morning, viewers. Welcome, welcome, welcome back to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Como Cancer Foundation. Today, in honor of Cancer Survivors Month, here we will celebrate resilience, hope, and the incredible journeys of those who have faced cancer and won. Joining me are two extraordinary individuals who continue to play a very interesting part in creating cancer awareness. And I've got Mrs. Gloria Oji Wajo, who is the president and CEO of the network of people impacted by cancer in Nigeria, NEPISIN, a 15-year, 2 times breast cancer survivor. And the nice young man, Otumba, and I'm going to use that today, Dayo Adebi, a passionate cancer patient advocate and researcher. Both are cancer survivors and champions of cancer awareness. You both look lovely. Good morning.
Good morning, Dr.
Thank you,
Dennis.
Jenny. Good morning, Doctor.
So what are we talking about today? It's nice to see your face. You are looking very bright. Survivors speaking, rising from the ashes of cancer. You know, you are rising from the ashes of cancer. I think we all are. So I want to thank you both for being here, and looking forward to. I think both of you, your stories have one time or the other been shared, but this time we're looking at it from the perspective of survivorship. Together we fight, together we win. Let's start this conversation. I want to try and make sure we get as much in as possible. So let's firstly look at the challenges that we face. So Gloria, let's start with you. What were some of the biggest challenges? I'm not asking you. I would like you to give a very quick explanation of who you are, your cancer journey. But this is my question. What were some of the biggest challenges you faced during treatment, and how did you overcome them?
Okay, first of all, my name is Mary Gloria Ojimaju, and I am a 2 times 15 years breast cancer survivor, all to the glory of God. And my journey started in 2010. I went for a treatment for cancer. I did chemotherapy 6 rounds. I went for a conservative surgery when my doctor said I could benefit from that. So I didn't have a complete mastectomy. And after that, I went for radiotherapy. I did 25 sessions of radiotherapy. And I was placed on hormonal therapy for 5 years, which ended in 2015. And in 2018, the cancer came, and I had to go back. I had a higher dose of chemotherapy, but it was not 4 courses. And after that, I was placed on another 5 year hormonal therapy, which I stopped last year. And yes, that's how my journey has been in the cancer space. And within the course of my treatment, I discovered a lot of gaps. It's not easy navigating the, medical, system of Nigeria. I saw a lot of gaps, but I'll still give all glory to the Almighty God, because I was more like, let me put it like the patient, the perfect patient, perfect patient in the sense that I really didn't encounter much of the challenges so many other cancer patients, encountered. I didn't encounter, machines breaking down. I didn't encounter the healthcare professionals on strike. I think I only did that before my diagnosis. So, and I didn't also encounter much financial challenges when I was during my first diagnosis. But during my second diagnosis, I am now coming to your question. During my second diagnosis, I was a pure charity case. And God came through for me through my doctor and the non-profit that I was, volunteering with. And so they picked up the deal. So if you're going to ask me the greatest challenge, cancer has a way of, no matter how, kind of savings you have and stuff like that, it brings you down financially and keeps you there. And so, yes, during my first diagnosis, I was able to go through my treatment without asking anybody. I think it was towards the end that my siblings came in for me, but it kind of kept me down. And so when the second diagnosis came, I didn't have anything to do, but God came through. So the greatest challenge was the financial challenge. And the second one was the awareness that a lot of my colleagues that are cancer patients were dying because of ignorance. We're dying because of a lot of misinformation out there. And that was what informed this decision to form the cancer patient support group, which we have. Currently, we have over 300 cancer patients on my group. So it has been wonderful because now we can pass the correct information to the right set of people, and it is almost at the tips of their fingertips. So you just go on the WhatsApp, you ask any question you're not sure of, and someone somewhere, I mustn't answer the question, someone somewhere answered. And I only come in when I see that maybe it is not really clear or it didn't come out the way it has to be. That's when I come in. So we have suddenly become patient advocates for not just ourselves, but for other cancer patients. So the lack of awareness and the financial aspect was actually my greatest challenge. Thank you, Dennis.
Thank you, Dio. I'm going to go to you now. But how about you? And what stood out as your biggest challenge? That's what I really want to know.
Uh, Thank you, Dr. Dennis. Majorly, the biggest challenge that we face as cancer patients are the fact that our cost of treatment on the very high side is too costly. It's almost unaffordable. No matter no matter how much you save, no matter how much you put in your account, no matter how much you put in your hospital wallet, it's just never enough. But aside from that, and the fact that we have this anxiety or fear, we have depression, we have a lot of weakened immune system. The way our body responds to things is not just the way it is, but before the diagnosis, it's not just the way it is anymore. We get tired. We get there's loneliness factor. There's the fatigue factor also. So I mean, and then the cost of medication, the cost of going to the hospital, seeing your doctor, asking the right questions, the ignorance factor in it. They're all the major challenges that we face. But however, the most important and biggest challenge that we face so far so good is the cost of medication and treatment.
Quickly, I didn't ask you. What was your story?
Oh, my story. Yes,
Sorry.
I am a colon. Okay, sorry. I am a colon cancer champion. Still on medication, still on my chemotherapy. However, I have been on hold for now because of my I'm supposed to do a scan. The scan, however, is very, very, very expensive, but I have been told to do some other things aside from that, which I have done, and I have been a colon survivor for about 5 years. I've been on treatment for about 3.5 years, and to the glory of God, I'm alive, surviving, and also a champion in the advocacy space, in the advocacy cancer space. Thank you.
Awesome. Very nice to hear. Very nice to see you smile this morning, considering.
Thank you, Doctor.
Show me I know you. During those difficult times, now this question is for you, Dio. During those difficult times, were
Yeah.
there specific people, habits, or beliefs that gave you hope? And
Yeah.
because I understand the journey, I, I, it's important that other people recognize One size don't fit all.
So the people who gave me hope, number one, were survivors. People I met at the hospital while I was going through my own diagnosis. I got a lot of help. There was a particular man who had liver cancer. He was on a terminal case. I was looking at myself. I thought I was going to die also, but I looked at this man and I said, yes, if he was dying, he was giving us goodwill messages, happy, dancing, praising God. So that was an habit I took note from. However, I didn't see this early enough. I went through the stages of depression, the stages of being lonely, the stage of being sad, even to the point I felt like I should even kill myself because what next? You know, those are all the things I was doing. He being there with me in the hospital gave me hope. Then my family and friends, I want to give God for them. They have been wonderful people. My family is wonderful. The friends I have, I don't have too many friends, but the little I have, they've all been a blessing. Also, the medical teams, the doctors, the nurses. I was a big crying baby. Everything made me cry. I felt life has ended. My life was like on a standstill. Nothing was going forward, nothing was going backward. It was just on a standstill. So I want to thank God for the family and friends I have, the survivors, NEPISIN, the network of people impacted by cancer in Nigeria, the Commode Cancer Foundation, all the survivors who helped me through this journey has been a fantastic. They have been helpful and they have been wonderful. And I also want to thank the doctors and the nurses, however, how incapacitated they are, because the numbers of patients are overwhelming. Number of patients that don't have support, that don't have help, and they have to attend to them, and they have to keep on put smiles on their faces. I want to thank God for the doctors and the nurses who have been wonderful and have been serving the purpose that they're called upon. Thank you, doctors. Thank you, nurses. Those are the people that have been helpful to me.
We're now saying thank you to the doctors, and we have to say thank you to all the medical team across
Yes,
the world, to be honest with you, um, especially those who are actually qualified to look after us. They,
yes,
in their small numbers, they are still doing a fantastic job. I was actually in
yes,
Nigeria last week and I was very sick. You guys remember that?
yes.
And I knew what it was like. So, yes, we are saying thank you to the doctors. Um, so I'm going to ask Gloria, how has surviving cancer changed your view of life and your priorities? And when I'm saying that,
Well,
I'm asking you because you know that all of a sudden I believe that something changed. You get a squint squint in your brain that realigns. Go on.
thank you, Doc. Being diagnosed of cancer actually changed. In fact, it changed almost everything about me. First of all, yes, I have always been close to the church, but I realized being diagnosed made me a much better person. I learned to let things go. I learned to accommodate others more frequently. I learned to be less angry. A lot of things. See, when you're faced with a diagnosis that you're going to die anytime, it's not there was no hope in 2010. Advocacy was at its barest, level. There was nothing. The only thing I knew about cancer then was that if you have cancer, breast cancer, they cut it off and you will die. That was just the basic knowledge I had about cancer. And so when I had it, I was already preparing for my death. And the first question I asked the doctor was, how long do I have to live? And within me, I felt everything had already stopped. I was in the middle of an exam, at my PhD exam. I stopped everything because to me, it didn't matter. I couldn't go on. What was I using the certificate for? So there's a kind of finality that comes with that, the news of one's diagnosis that changes your life 360 degrees. But my faith still helped me to go through. First of all, I never was in denial. I have to be honest with you. And I knew it was my faith in God that this thing came not from witchcraft. This thing came not from any other source. Okay, if you're looking at somebody because I was asked by my doctor, do you smoke? No. Were you on contraceptive? No. Do you have a family history of breast cancer? all the factors were negative, negative, negative. And I remembered my doctor describing my case as bizarre. So after that, I told myself, this thing came for a purpose, and I just have to accept it and open my mind to allow God to use it for whatever. If I'm going to die, it is fine. If I'm not going to die, it is fine. But something somehow must come out of it. And so that helped me. I was never in denial. And that helped me to navigate through my treatment without being distracted. I did it. I never, during my treatment, I never said, okay, I'm not going to go to the hospital. I was just seeing it as, oh, this is the place for chemo. This is the place for this. This is, that was how I took it. And I kept on surviving. And I was like, wow, 1 year, 2 years, 3 years. And now we are talking about 15 years, all to the glory of God. So I believe it was for a purpose that I was kept alive. It was for a purpose that I had cancer in the first place. And so this has really changed me, and it has also impacted a lot of cancer patients, because now cancer patients have a voice through the advocacy we have been on. So it did change my life.
I'm very glad to hear this. You just gave me some positive. You see, I always say this thing. It's very nice talking to cancer patients as a cancer patient. You actually draw a lot of strength. So those of you out there that do not know, find a cancer patient to be your body, because this discussion is very key. You said something. You said you are now 15 years. Yeah, I'm 9 years. And so I have to continue to fight now. I can't.
Yeah.
I can't see and keep no, can I?
Yes.
All this while telling you guys is nonsense, isn't it? Okay, now
Yeah.
we're going to fight this thing. We'll fight it and continue. So I mean, a lot of
Amen.
people know that I've been battling with whether I want to continue. So now I've had to say it now because of what you just said. Yes, Gloria, you've just given me some more to know why I have to continue. Thank you very much. Dayo, what advice would you give someone currently fighting cancer in Nigeria today? Please.
My number one advice is don't go through it alone. Do not isolate yourself from everybody. It is usually a very difficult, to even comprehend the fact that you have cancer. It's devastating already enough, but do not go through it alone. Believe that you matter, no matter how you do it. Focus on your health and prepare financially. Prepare financially. Take control. What I always say to everybody, work on your mind. Take control on your mind, your mental space, your mental capability to hold and absorb the situation on ground. Hold it together and prioritize on your nutrition and rest well. Because for me, I'm a workaholic. I sometimes don't know how to control myself when I'm working, but cancer has brought me to a point that I know how to just flat out and rest a little bit. Even in the midst of this, I still try to still work, but but the most important thing is work on your mind. Do not stay alone. Your mind is very important, because cancer can make you feel like the world has ended, you're about to die, but in your head, believe that there is God, believe that there is hope, believe that there are people that are hearing whatever you are fighting for, and they are there to support. Do not think you're alone. We are all here together, our support groups, foundations, advocating on cancer, so you are never alone. That's my advice to everyone.
I agree with you. You're not alone, please. We're all telling you the same thing. You're not alone. Don't stand there and allow yourself to be alone. You will crash. We're giving you that advice. You will crash. It's not a matter of anything, and then you will lose it. Me, I draw
Yeah.
strength from cancer patients across the world, because I know I can't do it on my own. Gloria, what's your quick one sentence advice before we start rounding up?
Um, I just want to, tell the cancer patient out there that it's not your fault. Sometimes people make us feel guilty. It's our fault. Dear cancer patient, dear Nigerian cancer patient, it's not your fault you have cancer. It's not your sin. It is not because you didn't do well enough. It's not because you did not contribute to the church or mosque. It is not because you smoke. It's not even because, oh, you led a wayward life according to what some people tell me. It's not. It came.
Mm.
And like Dio said, with faith, you can fight it and you should fight. Don't ever give up. Hold on. And when you discover it, please go and start treating it early, because early detection and treatment is the key to survival.
Yeah.
And like I keep on saying, wherever I go, I tell them, nobody knows your body more than you. If you're waiting for somebody from somewhere to come and tell you, it's not true. You should study your body. You should do a self-breast exam. You should know when something is wrong with your body. And you should go check it out. And so that when it is discovered early, it is treated early, and chances of survival are higher. And it is even, most importantly, cheaper to treat. And so that is my advice to fellow cancer patients.
I like that piece of advice. You know, we have to detect early. Please, I'm telling you, detect early. I started this journey on stage 4. It's not easy. It's not jollof rice. Please, just do the right thing. If you know, you will not get it this far. Please. Tayo.
Yes, doctor.
Now. So, uh, what would you like the Nigerian community to understand about cancer survivors and their fight? What do you want them to understand? What do you want them to take away?
Number one, we are wonderful sets of people. We are proud and we are happy, and that we know that as we fight, we have people around us that are supportive and that can help us to navigate what we are going through. I want to tell whoever is out there to listen, to hear what we cancer survivors have to say, to support, to understand that we are not just fighting for ourselves, but we're fighting for every Nigerian. Because to a large extent, government plays a particular role in making sure things go easy for our health system. So I am begging and I am pleading to everybody in the health system, in the governmental space in Nigeria, to fight, to help make cancer treatment, cancer support, cancer on the cancer mental health space to come together and make sure that we have a structured framework for cancer survivors in Nigeria. And that is why this Survivor Month, which is particularly dedicated for Cancer Survivor Month, we are making sure we speak out and shout out and have summits and have meetings and everything to tell the world that cancer is here in Nigeria and that we need support and that we need help and that we need people to hear our voice, understand, and know that the cancer is not our fault. It is not because we wanted to have cancer, but it is what just happened, and that we have to keep fighting and moving on. Thank you, ma'am.
Thank you, Dayo. Thank you. And I'm finishing up now. I want to thank both of you. But I'm going to say something as I share for your courage and for sharing your stories. Your journeys inspire hope and action. Gloria, Mary Gloria, I believe that you have something coming up. Can you tell us quickly what it's about as we finish up?
Okay, we are actually, yes, I'm going to be, we're actually organizing a cancer survivor summit. And in this summit, we want to be, it's no longer we being the spectators. We are going to be on the table talking to our doctors and our healthcare professionals, our nurses, our pathologists, our palliative care specialists. We want to talk to them. We want to tell them, let it come from us. Not just what they tell us to do, that this is us. We want to appreciate them too for always being there for us. We want to let them know that in as much as they know the treatment for the disease, that's we, the cancer patients, know the disease.
Thank you, Gloria. And to our viewers, remember, early detection saves lives, support survivors, educate others, and join the fight. Follow us on Common Cancer Foundation, Nepicine, Kakaki Cancer Awareness on social media. Together we fight, together we win. It's been very nice having you all, and we will see you in 2 weeks' time where we continue our conversation again. Happy Cancer Survivors Month. Enjoy yourselves.
Thank you.
Thank you very much.
Thank you.
Our message is very clear. Together we'll fight, together we win.